Let's begin this section by discussing the pectoral girdle, including the scapula and the clavicle. This anterior view depicts the bones of the pectoral girdle, the clavicle, and the scapula. The clavicle is located at the top of the rib cage, and it articulates with the sternum. Here are the same bones in a posterior view along with the humerus or upper arm bone. The pectoral girdle is made up of the scapula and clavicle. The pectoral girdle is the articulation point between the upper arm and the chest. The clavicle bone extends from the scapula to the manubrium portion of the sternum. The scapula or shoulder blade is attached to the clavicle, but it has no direct connection with the axial skeleton. The first bone of the pectoral girdle we'll discuss is the scapula or shoulder blade. This lateral and posterior view of the scapula depict the different surface markings and regions. The acromion and the coracoid process are two key processes in this bone. Also, you'll notice in the lateral view is the glenoid cavity, and this is where the articulation between the head of the humerus and the scapula takes place. The acromion is attached through a spine to the rest of the scapula. In the posterior surface, we can see the body, the lateral surface, and the inferior angle. The scapula is roughly triangular in shape. It's a flat bone that makes up the posterior portion of the pectoral girdle. The scapula has three sides that form its triangular shape: the superior border, the medial border, and the lateral border. The glenoid cavity, or glenoid fossa, articulates with the humerus to make the shoulder joint. The two major processes of the scapula. The acromion is one of the two major processes of the scapula bone. It projects anteriorly at a 90-degree angle from the lateral end of the scapula. This process serves as an attachment point for the trapezius muscle, and the trapezius muscle extends from the occipital bone to the lower thoracic vertebrae. This muscle supports the weight of the arm as it rotates and depresses the scapula bone. The coracoid process is the second major process of the scapula. It's an attachment point for the short head of the biceps brachii muscle. The coracoid process projects anteriorly and slightly laterally. The biceps brachii muscle is on the anterior surface of the arm, and this muscle functions across three joints. This muscle functions to supinate the forearm and flex the elbow. Both the acromion and the coracoid process are attached to ligaments that support the shoulder joint and the joint capsule. Here's a clinical challenge exam question based on what you've learned so far in this tutorial. An 18-year-old male is brought to the emergency room after a car accident. The emergency physician eventually diagnoses the patient with a fracture of the shoulder. The fracture is in the portion of the scapula that's directly superior to the spine. Based on this information, which of the following is correct? A. The patient fractured the inferior angle of the scapula. B. The fracture is in the process of the scapula where the trapezius muscle attaches. C. The patient has fractured the glenoid cavity. D. The accident has caused a fracture in the coracoid process of the scapula. Or E. The fracture is in the process of the scapula where the biceps brachii attaches. Here's the answer to the question. Based on the information given, it's stated that the fracture was directly superior to the spine of the scapula. The question tests your knowledge of the anatomy of the shoulder, specifically the scapula bone. The correct answer for this question was B. The fracture is in the process of the scapula where the trapezius muscle attaches, and that is the acromion. The second bone of the pectoral girdle we'll discuss is the clavicle bone. The clavicle bone has an acromion articular facet at the acromial end of the bone and it curves up towards the sternal end. The clavicle bone braces the shoulder and connects the pectoral girdle to the axial skeleton. The two clavicles support the weight of the arms, and they articulate with the acromion of the scapula. The clavicle originates at the lateral border of the manubrium portion of the sternal bone. The structure of the clavicle bone. The sternal end of the clavicle gives rise to the somewhat S shape of this bone. The clavicle is located just underneath the skin, and the acromial end has tubercles that are attachment sites for ligaments and muscles. At the sternal end of the bone is the costal tuberosity, and this is an attachment site for ligaments of the shoulder.